what we can do is change the perspective of clinicians, for example, emphasizing the importance of functional capacities.
I'm Adam Hunt, and this is the Evolving Psychiatry podcast, rethinking mental health through an evolutionary lens. Share it with the people who matter, like it if you like it, subscribe if you want to hear more. So Alfonso Troisi, MD, is Professor of Psychiatry at the International School of Medicine of the University of Rome, Tor Vergata. He's the co-author of Darwinian Psychiatry, an Oxford University Press published in 1998. And his research and clinical activity focuses on the evolutionary study of behavior. His chapter in the Cambridge University Press volume is titled Evolutionary Thinking and Clinical Care of Psychiatric Patients. So Alfonso, thank you so much for joining me today. This is perhaps the most important chapter in the book, in that it's really talking about psychiatric, what psychiatrists are here to do, the clinical care. But you do begin by noting in the chapter that various psychiatrists have dismissed evolutionary thinking. They don't think it's relevant. So what do you think they're missing?
Well, I think that there are probably many reasons for this problem. The first reason, I think it's related to the fact that much studies, much papers are about the origins of mental disorders, because of course evolutionary students ask the question, how is possible that there is the persistence of mental disorders in the populations, and these disorders were not selected against? This is a very important theoretical question, but it's pretty far from the interest of clinicians, because of course the interest of clinicians is related to practical problems like diagnosis, prognosis, therapy, and so on. So the first reason, it's a distance between a theoretical approach and a practical approach, that it's typical of any kind of clinical science, including psychiatry. Another reason, I think, it's probably related to the background of evolutionary students, because many evolutionary students are biologists, anthropologists, ecologists, evolutionary psychologists. And so if you are not visiting every day patients with mental disorders, probably you are not so interested in clinical problems, okay? Instead, in my case, for example, I do everyday clinical practice. And so in my mind, of course, there is the background, the evolutionary background. But the problem that I face every day is how can I help this person? What is the application, the practical application of the evolutionary approach to the problem that I'm trying to solve?
Right. Yeah, you have this difference between like the scientific, we're just asking questions, we're trying to just understand what's going on here, versus the psychiatrist who's very practical and really just wants to fix the problem. So what do you think we can add? What does an evolution-informed diagnosis and treatment regime look like to you? How do you think evolutionary-informed psychiatry would differ at all from current practice, or are there not that many differences? I mean, what do you think about this?
Well, based on my evolutionary studies, I have an experience with non-human primate behavior too. So I'm pretty familiar with the ethological method. Well, what I think is that the big problem of psychiatry is the emphasis on mind, the emphasis of subjective feelings, and in addition, the artificial settings where we collect data. The typical situation is the patient comes to the hospital, comes to the doctor office, and we listen all the reports by the patient. We have no idea what is the reality outside, what is the real behavior of this person outside in real world relationships. In this sense, I think that we really can apply the lesson of two evolutionary disciplines applied to behavioral sciences. I mean, ecology and ethology. I think it would be very useful to have, real world data about the behavior of persons with mental disorders, and trying to understand what is the difference between the data that we collect in artificial settings and the data we could collect in the ecological environment of patients. I think that this is a very important lesson for clinical psychiatrists.
Right. Yeah. This thread runs through a lot of your work, which I'm aware of beyond this chapter, of course. And yeah, you do note that psychiatry is concentrated so much on these questionnaires and ticking these boxes. How are you feeling? But evolution acts on behavior.
Yeah.
So we really should be studying behavior. And if someone is suffering, is it really harming them? Are negative emotions or bad thoughts actually kind of interrupting their reproductive success?
In addition, you should consider that many data, also in research, derives from rating scales. Okay, rating scales apparently are treated as real numbers. They are not real numbers.
Right. Yeah.
Okay, they are just ratings translating what the patient says in false numbers, qualitative impressions, but they are treated, as real numbers and compared with data coming from biological studies, and
Right.
I think that this is a big problem.
Right. Yeah. On the scale of 1 to 6, how much have you been feeling this way? Okay. Yeah, it makes it easier for statistical analysis, obviously, but yeah, you're right to question the scientific validity of this. So okay. So looking forward, clinical care in psychiatry has generally not improved over the last 50 years. One of the reasons I think evolutionary psychiatry really has a chance to kind of make an impact is because psychiatry is a field kind of in crisis. We haven't really made any improvements, both in treatment or in understanding, and hopefully the evolutionary perspective may improve that understanding. But yeah, what do you think the evolutionary perspective might add also to the clinical care, or just in general? What do you think evolutionary psychiatry can just add that will change how psychiatry has been going so far?
Well, I see that the contribution probably is more strategic than tactics. I mean that I don't think that would be possible to invent a new cure for mental disorders based on evolutionary knowledge, okay? Because any kind of new treatment is based on proximate knowledge. And of course, proximate knowledge is not the peculiar feature of evolutionary thinking. What we can do is change the perspective of clinicians, for example, emphasizing the importance of functional capacities. If you look at the diagnostic assessment in psychiatry and even the way for assessing the outcome of therapy, there's a big emphasis on symptoms. So like anxiety, depression, hallucination, delusions, and so on. And very little attention to functional capacities, to the capacity of the patient to navigate the social environment, to reach the short-term biological goals, and so on. Why this is important? This is important because we have data that the well-being of patients sometimes is more related to functional capacities than to symptoms. Some patients say, okay, I don't have symptoms, but my feeling of my function is so bad. I don't want to stay in that kind of situation. And the other problem is that, according to the evolutionary model, it's possible that the primary defect is in the functional capacity, and the symptoms are just the outcome of the original problem. Okay, so for example, take a borderline patient. Okay, she's not able to navigate social relationships, frustrating intimate relationships, and this is a basic defect. Of course, the outcome is anxiety, depression, hostility, but for psychiatrists, these are the primary targets. This can be really a problem, because if you are not able to change the functional capacity of the patient, the symptoms stay there.
Mm-hmm. Right. Yeah, this sort of came up in my discussion with Randy Nesse as well. It's not so much that we're going to add some special new treatment, but maybe it makes you think about how you go about a treatment program. So if someone's got anxiety, then maybe you do want to use pharmaceuticals to kind of improve their living standards, but you also want to think about the world that they're living in and why they're feeling the anxiety, and kind of see it in this functional perspective, and maybe try and remedy the things in their life. And yes, you can use drugs to kind of help get you there, but yeah, it gives this more holistic view rather than seeing a symptom and throwing a drug at it and assuming that you're actually going to kind of cure it. Great. Well, thank you so much, Alfonso. It's a really interesting chapter. It's like a really, I mean, it's obviously it's the point of why we're here to some extent, is to try and improve the clinical care of psychiatry as well as the scientific. We just want to know as well. I just want to know. But yes, thank you so much for joining me.
Thank you, Adam. Okay.
Cheers.
Bye.